you doing, Jocelyn?
I'm watching some videos about a patient that's about to come in.
Wait, is this Raven?
And it's all over her scalp.
My name is Raven Taylor, also known as Psoriasis Barbie on all platforms. Oh, I'm sorry. I have to apologize constantly because my skin is everywhere. Psoriasis is an autoimmune disorder. Your brain is telling your body to keep growing skin because it feels like you don't have enough. You see, as I take off my gloves, the skin just falls like everywhere. A lot of my followers, they like me to use special tools to peel off the excess skin. I just hit 130,000 people on my YouTube. 130,000 people have seen me. So yes, I make money off of it because I'm the psoriasis queen. I'm the voice of the people. Y'all can see it's real. My hair is in it. It started when I was 14 years old. I started taking medicine. It was like ointments and stuff in my hair, but it wouldn't stop. So I shaved my head because I get big giant scabs on my head. Sometimes if I descalp my hair, big clumps of my hair will come out with it. It just was falling out in patches because of the plot. So I would be excited if I could have my hair back. Okay. I'm supposed to take an injection called ustekinumab every 3 months to control it, but it'll work for a little bit, and then after a little bit, it doesn't work anymore. So as of right now, I'm using creams all over my whole body and saran wrap myself. Going out, I keep myself covered so people don't stare. I don't have to answer questions. And then also, I don't want to embarrass my son when I take him places. Jakai is my son. He's 7. He is an amazing, funny, hard-headed, joyful, playful, hungry hippo kid. When I was pregnant, I was praying every day, God, please don't let my baby have psoriasis. And if he do got it, just let him get it a little bit.
That was quick, right?
Jakai asks me all the time, like, why is it like that? I just simply tell him it's a skin disorder. But psoriasis is not just some skin disorder because a skin issue can turn into anything. It can turn to infection, to your whole body being infected, to your dying. It could just lead to so many things. You just never know. I get pain management from medical marijuana, and I smoke cigarettes when I can't smoke my marijuana. People don't understand how painful it is. I've been to a few doctors in the past and nobody helped me. So I'm gonna go see Dr. Lopez in Houston, and I hope that she genuinely can help.
Well, hey there, Teresa. What do we have on the docket for this afternoon?
We have Mir coming in at 11:45.
Looks like he's had some procedures done before. So the challenge is probably going to be, is there anything left that I can do to make an improvement?
My name is Mir. I'm 42 years old, and I suffer from male pattern baldness. Oh, God. It's a significant problem. It affects the average man who hates themselves and wants to jump off a cliff whenever they suffer and look in the mirror. I'm sorry. I didn't really start noticing until I was 25. There was just this bald spot on the back, and I really didn't know what to do about it, but that was just manageable. But then towards 2010 and 11, I started noticing the front. So I got a transplant back in 2016. This was transplanted hair. That's the good part of it. I think some of it maybe fall, I don't know, but I put so much gel in it, I can't even separate it. It's all stuck together. I'm afraid to mess with it because I don't want it to fall out. I don't want to separate it, and it's like, I paid a lot of money for this. So I started using more hair fibers and things like that to conceal the back of my head. And hair fibers are like black powder, basically, that masks bald spots. Gotta shake them, make sure they're loose, and I start just kind of. It was good. It served its purpose. It helps, just like that. But I'm still bald. I was bullied a lot as a child, even when I had a full head of hair. Now, when someone makes a crack about my hairline, it does take me back to that place. And it kills my vibe for the day. Let's see, and then just kind of alternate. I hate being bald, and maybe my attempts at trying to do something about it draw more attention to it, but that's all I do. At least I'm trying to do something about it rather than just saying, woe is me, oh well, and feeling helpless. It looks like I have a fuller head of hair. But it still looks ugly. I just don't feel like myself. I'm about to go visit Dr. Angie. I've heard she does great work, which obviously gives me some comfort, and I'm hoping she could get me a full head of hair.
Hello, hi.
Hi, how are you?
All right, let's go upstairs so I can get to know you a little bit better.
Sure, that'd be great.
Knowing that Mir's already had the other hair restoration procedure and he's advancing in just his natural hair loss, I anticipate that I might have my hair restoration work cut out for me. Pardon the pun. All right, so tell me a little bit about what brings you to see me.
2016, I got a transplant. I hate everything about it. It was a smaller procedure because that's what I could afford at the time.
You just did what you could afford and it wasn't enough to address the entire area. Okay, very good. So now we can move into the business of evaluating your scalp and your donor area. So let me have you take your hat off for me. Let's take a look here. In doing a hair restoration procedure, we take hair from the back of the head in the donor area and move it to the balding area. In Mir's case, he's already had a restoration procedure once by someone else, and so now I have to really evaluate his donor area to see if he's a candidate for another hair restoration procedure. Yeah, we definitely need to get this detangled. He's got this long piece of hair that is from his previous transplant that he has kind of neglected, and it's all just a big mat of hair. And I'm just like, what hairy mirror are you looking in? All right. I think Mir was so afraid that that transplanted hair from the first procedure, if he combed it out and it came out, that it wasn't going to grow back in. And how many procedures did you have? Just the one?
Just the one, yes.
Okay. All right, so yeah, it does look like they did a pretty decent size of procedure from the length that I see that your scar is. Mm-hmm. Normally, there are 5 major steps to a hair restoration procedure. Number 1 is removing the donor tissue. Number 2 is sewing it back together. Number 3 is dissecting the individual hair follicles out of the donor tissue that we removed in step 1. Step 4 is for me to make all the little incision areas where we're going to place those grafts. And step number 5 is coming back and putting those individual hair follicles in the incisions that I made with step number 4. Okay, Mir, so let's have a realistic discussion here, okay?
Okay.
There's a lot to digest here in what's been done with Mir, and it's going to limit the number of grafts that we're able to harvest. So there's some difficulties in his situation that I really have had to look at to see whether or not I'm going to clear him as being a candidate for surgery or not. In your top area, your recipient area, the surface area from front to back and side to side is pretty significant, okay? And your donor area is relatively limited.
Mm-hmm. My whole life should not be dependent upon me having a full head of hair. I know this, but I don't have the best self-esteem. So if I get the help I need today, I'll feel a lot less ugly than I normally do.
This isn't magic, you know, you can't take, if you don't have enough hair in the back to move it to the front without depleting the back. I mean, we have to work with what we've been given.
Right.
We got to deal with the cards that we've been dealt.
I understand that.
Okay, so.
I'm calling for my niece. She's not feeling good. She's running a temperature, nauseated. What's wrong? Why are you crying? Come here. Why are you crying? What's wrong? What's wrong? Look at me. What's wrong? You can't come. You know you can't come cry.
Yeah. What's going on?
She got psoriasis really, really bad. She can't hardly walk. She can't walk. Can't reach the wall.
Doctor, I have this patient, Allie.
Okay.
She was born with this rare condition. Her hair seems to be really dry and frizzy.
A bad hair day for me is every day when I don't have 5 or 6 hours to spend on it because it takes so long to comb it out. My name is Allie Harrison, and I have spun glass hair, also known as uncombable hair syndrome. Spun glass hair just means that the part where my hair comes out is shaped differently than other people, and it causes my hair to be really squiggly and kind of stand out real fuzzy. I have had uncombable hair syndrome since I was about 3 months old. My hair was very wild and stood up, and, you know, the shorter it gets, the more outwardly it gets.
Did you like your hair when you were young?
I did not like my hair when I was young. There were times that I dreamed about shaving it off and wearing wigs.
Hi, are you Allie?
I am.
I'm Ryan.
Nice
It's good to meet you.
The only history that I have with seeing a doctor is when I was 2 or 3 years old. My mom had taken me to the dermatologist, and he pulled my hair, a little piece of my hair, and looked at it under a microscope and said that he hoped I had a good personality because I was gonna need it.
I'm gonna bring Dr. Singh in, and she's gonna take a look and see what we can do for you today.
Okay, thanks. When I think about hair, I think about stress because it has ruled my life. Just trying to fit in, trying to hide it. The amount of time it sucks out of my day just to feel like I can walk into the room without everybody staring at me.
Allie? Hi.
Hi.
I'm Dr. Singh. Nice to meet you.
Nice to meet you. I love your hair.
Likewise.
It is beautiful.
Thank you. So tell me why you're here.
I have spun glass hair, uncombable hair syndrome.
Okay.
And so that's kind of, I guess, what I want to confirm.
Sure.
And how to take care of it. Just anything really that you can tell me.
Okay, well, I'm gonna take a look at it.
Okay.
Uncombable hair syndrome is a rare condition. I have only seen one other patient with this personally, so I hope I can help her.
I'm just gonna piece through your hair a little bit, okay?
Sure.
What I am seeing is that, yeah, you have a high density of hair, and your hair caliber, as in the hair shaft, it's thicker. It's caused by a mutation in a gene that codes for the hair shaft. The best way to diagnose it is to look at it with electron microscopy to see these characteristic changes with the hair shaft. Okay, so you have that kind of glassy, shiny appearance to the hair.
Looks like it's got gold on it.
Yeah, it does look like a golden kind of sheen around the outside, and then it changes as you go down.
In my adulthood, I actually have not seen a doctor to confirm nor deny what I have, uncombable hair syndrome. So just having a doctor say, yes, it's confirmed, would be so freeing and validating and just all of those good words.
So the uncombable hair syndrome, and I do agree with your diagnosis, and as I was looking at it under the microscope, you can see that kind of glassy look as we looked along your hair shaft. You know, it was glassy. I'm sorry.
No, it's fine. It's just nice to hear it. I'm sorry I'm a cryback.
No. I'm so glad to meet you and that we're able to talk about this.
I got made fun of a lot as a kid, and that deeply scarred me. It was hurtful that something that I was born with, that I couldn't control, that they would just hate me or think negative of me just because of my hair.
There is a genetic mutation that leads to it, and unfortunately, this is not something that can be quote unquote fixed. There's no cure for this condition. So I think the main thing is to talk about how to manage it now. So because there's no actual treatment or cure for it, the goal is to get her to love her hair as it comes out of her head and find ways to manage it more easily. I'm gonna have you see my friend. She's a celebrity hairstylist. Her name is Tippy. She is amazing. She is a texture expert.
Oh my gosh.
Yeah, and she lives right here in Kansas City.
Oh, wow.
Yeah, so I can't wait for you to meet her.
Me either.
Exactly, right? So she's gonna talk to you about more healthy hairstyling practices.
Oh, that's so exciting. I'm actually really excited about meeting the stylist, Tippy. It might come out that I have just, the big hair that I've always had, but I'm hoping that she'll be able to tell me what to do with it.
Bye, Allie. Nice meeting you.
Bye.